Hi, everybody. Thank you for your patience with the technology. It's kind of good to be thinking about the challenges we have with technology sometimes because we're going to be talking about telehealth today. So, um, we're going to be talking about telehealth and how it's really transforming the care that we deliver especially for people in rural and underserved communities, which is, of course, our focus here in iEcho. And to introduce myself a little bit, I'm Colleen Fox. I'm the Director of Adolescent Services at Hinamauka Teen Care. And I wanted to start by sharing a little bit about our experience with telehealth. Before COVID, Hinamauka, we used telehealth in small ways. So we used it to connect with our families and our youth program. And we also used it to expand psychiatric services for adults. And of course, but when the pandemic hit, it changed everything. And so we had to quickly scale up our telehealth, develop policies, train staff, ensure we had the right technology to deliver behavioral health services remotely. And so fortunately, we had begun contingency planning for our residential outpatient, school-based, and our family programs a month or two before the shutdown. Our CEO was paying attention to what was happening in China. We were having meetings starting in January. And and the other thing is that we were already using Zoom for meetings and some client services, and we also had access to laptops and cell phones. And also I was watching the school closures in New York and San Francisco because my family lives there. And so we'd really, even before spring break, we had prepared students to go remote. We'd been talking about telehealth before spring break. So that helped us a lot when everything happened. And then when the shutdown was announced, we quickly trained the staff on Zoom and telehealth practices. So we had some people trained, but then we trained everybody. And we updated our technology, ensured everybody had access to Zoom accounts before transitioning to remote work. And then during that time, we had daily virtual meetings, and that really helped us to adapt, right? And we really used shared knowledge, and people shared their experiences. We had to use a whole variety of platforms because in the DOE they used a whole variety of platforms, and people shared their knowledge, how to use all the different little tools that we are so used to seeing on Zoom that were new to us using those and different games, different activities that we could do, and also really kind of how we're changing our procedures, our forms, making sure our policies are updated, and then developing virtual group activities. That was really important for us, and really just how to improve client engagement. So, like many of you, I'm sure that tale feels very familiar to many, if not most of you, about the ways that we've kind of faced challenges, but really gained really valuable knowledge along the way. And so as time has passed, so we have the benefit of experience and research. And so my goal today is to explore the barriers with telehealth and share strategies to make it easier and more effective. So at Hinamauka, we still use telehealth along in-person activities. And of course, the real experts are my counselors who use it, every day, every week. And so in my role, I really get to step back, reflect on our experience, and look at how research and best practice can really help us improve. Second here.
Is it, you can try the return button on your computer maybe, or the arrow button, or
Yeah, I'm using those.
Oh,
Yeah,
my goodness.
I know. Isn't that funny?
Uh, ooh,
There we go. Got it. All right. So today we're going to cover key considerations for setting up telehealth, practical guidelines for clinicians and participants, and strategies to improve
it
engagement.
didn't advance for us, I don't think.
Yeah,
Oh,
we still see your title slide.
oh, why didn't it advance? Oh my gosh. I do not know why I'm having so many problems today.
Oh, maybe on the bottom. Oh, there we go. Perfect.
There
Now
you
we
go.
see objectives.
It's funny, I'd use a down arrow for mine and the side arrow for the other one. So interesting. Okay. Oh, I see it. It's on all three screens now. All right, good to know. All right, so we are going to start with a poll. And if I can get you folks see both of those, you guys see the, so I'm going to have you guys go ahead and, oops, sorry. I want to get a sense of everybody's experience with telehealth using a quick poll. So if you run into any kind of issues, we'll switch to the chat as a backup. And the poll is going to be open for about 30 seconds, so make sure you can see the presentation screen. So you should see the poll pop up on your screen, and you're going to click on one of the responses. So in your current medical practice or behavioral practice, how often do you use telehealth with patients or clients? All right.
Are you seeing the results?
I am.
Perfect. I'll leave it
So-
open for another 10 seconds.
Okay, great. So, all right,
Okay, end poll.
right on. So you see here that, can everybody see the poll? We shared it.
It's shared.
Okay, yeah. So you can see that about half of us use it every week. So we're using it regularly. So it's really a part of our daily practice, our regular practice. And then another big chunk of folks have used it previously, but aren't using it now. So maybe have used it in another position, used it during the pandemic, used it in other situations, but aren't using it now. And there's not that many of us folks who haven't. Only about 20 folks, or about 20% here, like that we really have a little bit of experience with it. All right, I'm gonna stop sharing that. All right. So we're going to move on here. Okay. So I wanted to just say a little bit about using polls in groups too. So that there's a lot of benefits to conducting. Gonna move this over here because I got it. There's a lot of benefits to using polls in group if you're conducting telehealth groups. So they can really help the facilitator to get real-time feedback on interventions and identify interests or needs and really gauge participant understanding. Polls can help to increase engagement, particularly among the quieter members of the groups too. So they can aid in group cohesion by identifying shared experiences or perspectives. And it also gives participants a chance to provide input without necessarily disclosing experiences that they may not want to share with the other group members. All right. So we're going to talk a little bit about the history of telehealth here. Telehealth has been around for about 60 years, and it evolved from early interactive television to the video conferencing that we use today. So in the 1950s, the Nebraska Psychiatric Institute used closed-circuit TV to transmit therapy sessions for training purposes. And this later expanded to hospitals across Nebraska, North Dakota, South Dakota, and Iowa, creating one of the first interstate health networks. And by 1968, telepsychiatry was being used outside of hospitals, really using Massachusetts General Hospital was connecting actually with Logan International Airport in order to using actually microwave television technology to provide mental health services to airport employees and the local community. And by 1970, they had expanded further, linking with the VA hospital and even the local junior high schools. So as technology advanced, so did telehealth. And even before the COVID pandemic, its use was growing. So it doubled from 14% to 28% between 2016 and 2019. And then came the pandemic, which accelerated everything. And so between March and April of 2020, telehealth visits for mental health increased by a staggering 556%. So that's a lot of increase there. Okay, so let's step back one more time. Let's step back and and define telehealth. So telehealth is a mode of healthcare delivery that uses telecommunication, technologies, and electronic information to provide healthcare and facilitate communication. So most people are familiar with synchronous telehealth, but telehealth also encompasses methods of communication that fall under asynchronous communication as well. So synchronous telehealth tools enable real-time communication between providers and clients, similar to in-person sessions, but through electronic devices. So instead of being in the same room, they connect virtually with a secure HIPAA-compliant video service. And while these sessions typically include both audio and video, they can also be audio only. And synchronous telehealth is the most common and effective methods for delivering services like assessments, treatment planning, group sessions, individual counseling, and case-based teleconferencing. Now, asynchronous telehealth, which is used a little bit, is used more commonly with medical providers and less commonly with behavioral health providers, but is still something we can be using more. Asynchronous telehealth supports prevention, treatment, and recovery through a variety of different kinds of applications. So the store and forward method lets patients send data like photo and videos to providers, typically medical providers, for review. E-visits are non-face-to-face patient-initiated communications through an online patient portal, typically used by medical providers. And remote client monitoring uses digital devices such as activity trackers, pill boxes, or other kinds of information to collect and send health data to providers. Mobile health apps offer support such as medication reminders, mood tracking, and treatment diaries. And client education allows patients to access educational content such as instructions, videos, articles, or decisional aids via electronic delivery websites or secure platforms. And finally, email, chat, and secure portals allow clients and providers to exchange non-urgent messages at their convenience. So it's really important to note that while these are all telehealth delivery applications, reimbursement can vary depending on the funder or the provider. Okay. So combining synchronous and asynchronous telehealth really expands access to care and enhances support for clients. So for example, cognitive behavioral therapy might include both live counseling sessions and asynchronous therapeutic journaling done sort of online or an electronic method. And medication reminders and other asynchronous tools can also complement real-time telehealth sessions. And many clients prefer a hybrid approach, blending virtual and in-person services based on their needs. And those needs can change over time. So that's something that we want to pay attention to. So for example, in our adolescent vaping cessation program, we combine virtual treatment groups with youth that are for the youth with in-person individual and family sessions. We also encourage participation in an asynchronous text-based support that's available online. And then we also offer a virtual parent support group for parents, family support group for families. And that's paired with asynchronous family education materials that we utilize that the parents review and outside of the group. So that way, it's a combination that allows for flexibility while still being comprehensive. All right, so let's take a second to share our telehealth practices that you use by typing them in the chat. The chat isn't working. Our backup plan is to unmute and speak, but most of us are familiar with the chat because we use it as our icebreaker and for our Echo icebreakers, of course, every week. And if you're not, look to the chat icon at the bottom of your screen, of your Zoom screen. It matches that black image on my slide, and clicking it will open the chat on the right side where you can type messages for the group. I know you folks are familiar, but it's when you're working with our clients, we want to make sure that new clients or patients that we kind of go through this, and we want to remember not to assume they know the platform or the tech terms. So let's go ahead and share in the chat what telehealth approaches do you use with your patients. And before we go over what you're saying in the chat. I'm going to give you another minute to do that. While you folks are responded, I just wanted to talk a little bit about the benefits of using chat when conducting telehealth sessions with patients. So, particularly in groups. So some clients really, especially those who are anxious or introverted, may feel more comfortable typing responses rather than speaking. And clients who have difficulty expressing themselves verbally because of trauma or difficult emotions may find the chat a useful alternative. Clients with hearing impairments or those in noisy environments can still engage by reading closed captioning and chat comments and responding in the chat. In group settings, clients can send private messages to the facilitator if they have concerns or if they need to step away. And it also allows for anonymous sharing. So where information is shared with the facilitator who reads the comments without including names. It can also really support reflection because the chat can support reflection by allowing participants to write out their thoughts before sharing as a way to process emotions more effectively. And then lastly, it can really reduce interruptions, right? So clients can contribute without necessarily speaking over each other. And it's really and in a group setting, it's really important to establish chat norms by defining when and how it should be used, monitoring for appropriate use, and balancing chat with verbal discussion to keep participants engaged. So what do we find in the chat in terms of how are people using telehealth? Dr. Withy?
Yeah, sorry, I'm trying to get back to my chat.
Oh, sorry.
But yeah, I don't know why. Anyway, so people said they were using it for telehealth visits. Let's see. Oh, you guys.
Dr. Collen said phone and Zoom. Michelle said therapy, psychoeducation, messaging related to scheduling. Mary shared therapy, video and audio, chat messages, and scheduling as well. And
Yeah.
then Diane said 100% therapy session support group.
Right on, right on. Right on. And that really reflects what we tend to see across our behavioral health field, that we tend to use telehealth in the most common format, which is the sort of the live talk approach. Though we do also use, like, for the messaging, the reminders, the information, that's something that we see less, but also is another thing that you see more commonly with telehealth. So,
and Monica says one-to-one counseling via Microsoft Teams, and Renata says providers use it to update other providers as to flow of clinic day-to-day workload.
Right on.
Oh, health functional assessments, interdisciplinary care team meetings. Oh,
right on, right on. Yeah.
We did have a question.
You
want that now?
Sure.
Does the use of monitoring devices ever transfer to providers without the consent of patients via MyChart, for example? Like apps talking to apps, for example.
That is something I don't have an answer for.
That's a good
I would
question,
imagine, though, you would have to have consents in place too, right? And it all depends on what service you're providing, right? So if you're providing substance use disorder counseling, you're going to have much stricter requirements about what can be shared with whom, though some of that's changing a little bit with the changes with CFR 42. But in the medical arena, it's going to be a little bit different in what can be shared, and it's going to be a little bit less, probably legal barriers for sharing of information is more common. But I don't know if anyone else has a response to that.
I suppose it would be like your blood pressure or your blood sugar monitor that goes directly to the office. Would your primary care office be able to share it with another office, or trying to?
I think you have to probably sign a record release of some sort, but again, that's all dependent on if the independent practitioner has all of those forms and the logistics of it in place. Because you can even do, like, they're working on like remote fetal monitoring for patients that are on neighbor islands that can't come in and can't fly up to do things like that. They have to do it from their home. So I think, yeah, a lot of, again, goes back to red tape, red tape and strong admin support.
Yeah. Yeah, and I guess it depends on what becomes part of your permanent medical record versus what becomes something that a person, a provider is using to track specific types of information, or like say the therapeutic journaling for behavioral health services, right? So it really depends if it becomes, yeah, part of my chart, or if it's something that is being tracked in another way through another HIPAA compliant device, or through an electronic portal that maybe doesn't take identifying information either. So, all right, right on. It's good. It's good. We're all thinking about client confidentiality and clients knowing where their information goes. So that's important. Okay. So we talk a little bit about the research on telehealth outcomes. So telehealth has been empirically studied for over 20 years. Research includes studies conducted within the last several years. So, right, so coming out of COVID, there's been lots of research on telehealth. And it's really highlighted the effectiveness of telehealth for treating mental health disorders. I'm focusing right here a little bit on mental health disorders. So, so there have been systemic reviews and meta-analyses that have found the quality of care delivered via live video is similar to in-person care for the management of mental health conditions. Systemic review found that using live video delivery to treat PTSD reported similar effectiveness, quality, and long-term effects with shorter total therapeutic hours than patients receiving inpatient therapy. And a meta-analysis reviewing 18 randomized controlled trials found that telehealth via live video had moderate to strong effect on the management of PTSD symptoms among veterans. A 2021 analysis of systemic reviews found that across all patient populations reviewed, video interventions were associated with significant reductions in symptom severity for anxiety, PTSD, depression, and substance use disorders, with outcomes similar to in-person interventions. And additionally, research comparing video sessions to in-person therapy for various conditions, including comorbid mental health and substance use disorders, Tourette syndrome in children, and insomnia in adults, consistently report similar improvements in symptoms and quality of life between the two modalities. All right. So we're going to talk a little bit here about bridging the gap between making it more accessible and convenient through telehealth. I'm going to kind of move quickly through this because I feel like we're all on board with telehealth too. But I think it's really important to kind of know this information. So when you talk to patients, when you talk to other providers who are maybe not as, have reluctance around using this particular delivery system, to kind of have that information to talk about it. So, all right. So telehealth offers benefits for providers. It includes flexibility. The providers can offer appointments beyond regular hours. It can reduce no-shows and cancellations. It can really help with care coordination between folks who are providing, say, behavioral health services, medical services, and other types of services that are within the healthcare arena. It can be a lot easier to coordinate with probation officers. All the different folks that are the people that we're working with are also working with. It's also very effective in addressing workforce shortages, particularly in rural and underserved areas. It also can really be helpful with like home environment assessments. So those can be conducted virtually, allowing providers to view a client's home, meet their support systems, and decide if an in-person visit is necessary. Videos, slides, and assessments can be shared instantly via live telehealth. So that's a really helpful thing. Okay. And providers can have more control over their schedules, fewer commutes, and greater flexibility to improve work-life balance. And now for telehealth also makes mental health and substance use treatment more accessible, convenient, and comfortable for clients. So telehealth connects clients with experienced providers, regardless of location, with some caveats with that, right? Like being within the state is often a geographic restriction for the provider, depending on the licensure and reimbursement requirements. So it makes it easier to find care that aligns with a person's cultural background, identity, and lived experiences. It also improves access for individuals with disabilities and those with limited mobility or transportation challenges. Telehealth can help to eliminate or minimize travel costs, can make attending appointments easier, and helps clients stay engaged in treatment. Receiving care from home can ease anxiety and discomfort and really help make sessions more effective. And the flexibility of being able to attend therapy without taking significant time off, and it can help family caregivers in managing childcare and other responsibilities. It bridges geographical gaps, increases coordination, and gives increased access to group interventions with outcomes that are similar to in-person sessions. It can be really helpful for clients in rural areas or small communities and to receive care discreetly without concerns about being recognized at a local clinic. If you're on one of the neighbor island where there's only a few providers, then it can really help people to receive services who might be reluctant otherwise. And really, sometimes despite initial hesitancy, clients often find telehealth as satisfying as traditional in-person care. So as far as the population benefits that, the treatments that have been delivered through telehealth have been shown to enhance health outcomes and quality of life, boosting mental health, reducing symptoms, increasing confidence in managing symptoms, and leading to higher levels of satisfaction than in-person care alone. And telehealth really supports recovery of substance use disorder, reduction in alcohol use, increasing tobacco cessation, improving engagement in opioid use disorder treatment. And benefits, one of the benefits are decreased costs. So, and particularly in rural communities, that telehealth can be implemented, and sometimes that will reduce like a full-time on-site behavioral health provider, or that's maybe remained empty for a long time too, with as needed, hourly fees too. I'm actually going to skip this because I'm afraid we're going to run out of time. But I did just want to say a little bit about this tool, Menti, because one thing I do want to talk about are the different tools that you can use. One thing I wanted that you can use when you're providing services. So Mentimeter, you go to menti.com. Let's just do it really quick. So if you want to go ahead and use a QR code to scan, or if you want to go to menti.com and use the code that we have at the top of the screen, 127100280. So most of you folks have used this, I've probably used this in trainings where you end up, they have things like a word cloud, or they have quizzes, different things like that that you can see. And if you go ahead and fill this out, you can do it through your phone. You can use your QR code through the phone, or you can open another screen and do menti.com and put in the code. And so this is an opportunity to talk a little bit about what are some of the disadvantages or challenges that we've had with telehealth.
You might not know the answer to this question, but how does physical exam accuracy compare with in-person versus telehealth? And is that photo an indication of the territorial quest to obtain Greenland?
Oh my gosh, let's hope not. The green screen with the people.
Where is the code?
The code is 12710280. So I'm actually just going to move on real quick. And does anybody want to share in the chat Oh, here we go. So connectivity and knowledge of the patients to use the technology. I think those are the big things. We'll talk about that too. Okay. So connectivity issues, yeah. And the platform isn't working. Yeah, the no privacy at home is a big thing that we all see with patients too, right? When there's like, can they find a space where they can talk privately? Lack of Wi-Fi access and privacy violations. Yeah, for sure. How do we maintain everyone's privacy when we're using telehealth? So great. So thank you guys so much. So so I'm going to move us along here. All right. Thank you guys. So we're going to talk a little bit about some of the factors that influence implementation of telehealth services. Okay. And so smartphones have really made telehealth more accessible for all different folks, really allowing for live video counseling and apps that support medication monitoring, symptom tracking, and client provided communication. But just like you folks just mentioned, not everybody has access or feels comfortable using telehealth, whether it's limited, has to do with technology or it has to do with privacy concerns. So to expand telehealth access, providers can consider strategies that really address the technology and connectivity barriers that you folks were talking about too. So because we know that clients are going to need a tablet or computer or smartphone and with reliable internet for video conferencing and e-health apps. So technical issues can really be challenging, or kind of old equipment can be an issue too, or the strength of the internet connection, right? They might need. So some providers offer devices or signal boosters or hotspots, but those do come with a cost. Some agencies will access grants for that kind of information. So I think providers are making an effort. And also, like when you work with youth, sometimes they can be borrowed in the schools. But one really great resource is that we have in Hawaii, we have the Hawaii State Public Library System will lend out hotspots and Chromebooks for up to 30 days. And they also have, and this is in every island, I believe, but they have telehealth navigators who will assist with appointments, technology use, and accessing health resources. So libraries are really trying to step in and sort of bridge that digital divide by being a resource. All right. So providers can really help clients to feel more comfortable with telehealth by addressing both its benefits and the concerns. So really talking about how telehealth is more, it's great for, we know that it has good clinical outcomes, but it can also really help improve access and comfort for people with pain, mobility challenges, preference for familiar environments. So really helping clients to think about on their particular circumstances, how will it be beneficial for them? Being in a controlled, predictable space can really help folks focus on their care sometimes too. And some participants may feel uneasy using telehealth, especially if they're not really tech savvy. So to ease their concerns, a brief pre-session setup can be really helpful. So assigning a staff member to walk new clients through logging in, using the camera, adjusting audio can really build their confidence, particularly folks who may, they're looking for different kinds of choices and they want something that's convenient, but they're nervous about using telehealth. So really helping them to test the platform, ask questions, and also reminding them that they can opt out at any time. Like just try it, just see how it goes. And if you don't like it, there's, we can look for other options. We can see like what kind of in-person services might be a little bit less convenient for you, but we can explore that. But why don't you just try it? Because actually people find that once they do engage in it, that it's that they actually like it. And then also providers may hesitate to use, providers kind of have their own reasons why they're sometimes reluctant to use telehealth. So some providers really embrace it, like many folks here, and some providers are more reluctant to use telehealth. So sometimes it's really a concern about the impact on the therapeutic bond client engagement or technical difficulties. But really, research shows that telehealth counseling really offers lots of benefits. So to help, really, organizations might want to think about how they can help their providers to feel more comfortable with telehealth. You can do that by staying informed about telehealth research to understand its impact on treatment and sharing that information. Offer training to build digital skills and gathering feedback for improvement. Highlight benefits like flexible schedules, a broader client base, and reduced burnout. And involve clinical or IT staff, kind of develop telehealth coordinators to help schedule visits, send reminders, and provide tech support to reduce no-shows and ease provider concerns. And then so the other piece of this too is building a strong client-provider relationship is really, we know that's key in behavioral health treatment services, but telehealth can sometimes make this feel a little bit more challenging. So to strengthen the connections, we can really engage in pre-treatment activities like discussions, planning, and training, and we can focus on the therapeutic alliance from the start to build trust. So one thing to keep in mind is that that this relationship starts at screening and assessment. So sometimes we're doing screening and assessment in person, and then we're doing the rest of services virtually, but sometimes we're doing services virtually right from the start too. So keep in mind that telehealth may not be suitable for all clients or stages of treatment, and have some treatments like drug testing are going to require in-person visits or a relationship with an outside clinic to do the drug testing. And that clients might respond differently to in-person versus video counseling. So a hybrid or in-person approach might be effective for some. And so for instance, for us, for our groups, for our adolescent community-based groups, we have, it's a hybrid of services, and the groups are virtual. But we do find that when the youth are struggling to keep connected and it doesn't seems like they are not engaging effectively, then we will do a hybrid where they can come into the office and be on their own computer and work with us in the office and still join with the group virtually, but then also be present, not so distracted by the things in their environment. And or sometimes we refer them somewhere else where they can get completely in-person services too. So it really depends on how complex the interaction is, that the intervention is that you're providing, and their comfort with technology, and just their service preferences in general. So this is related, kind of connected back to that question about who sees what, right? And so what information that's shared, what other providers might be able to see that? What about how does it go into my chart? So really, we really should establish a clear, informed consent process for telehealth that's going to be a little bit different than what we would do for our other services too. We really want to explain telehealth's role in the client's care. What is it going to look like? And why it might be why it's beneficial. And we want to address potential privacy concerns and emphasize the importance of them being in a private space. We also want to assure that on our end, that how we're going to maintain confidentiality of their information, or privacy, and that the other thing too is we're going to guide clients on how we're going to be communicating with them, what that's going to look like, and how we're doing that in a secure way also, so that they know what to expect too. And also too, part of this privacy piece is helping them to understand the technology too, the audio and video technology too, so that when they need to, the settings that they're going to be using too, so they know how to mute, they know how to turn off the video, and they need to maintain privacy during a particular disruption. So that's part of that communication that goes on too. We want to really inform clients about the storage of electronic communications and who may access them, which was that question that was asked. So you guys are thinking about this already. And then we want to establish a backup plan to address tech failures. So one thing too is that it's really important for providers to prepare for telehealth delivery. They can use a checklist to before each session to help kind of ensure that all the pieces of and the procedures are implemented. Can discuss how to maintain confidentiality and privacy during virtual sessions. And really, it also can be valuable to make it a standard practice to confirm the client's location and identity, make sure that there's no one else present in the virtual space, even off camera. And it can really reinforce the provider's commitment to confidentiality. Also, knowing where clients are during sessions also can help with safety planning too. And one thing I would just say too about planning is that there's so many things that we can do with delivering services, telehealth, that planning really helps with that. Setting aside a chunk of time to plan, to think about how you want to, what you want to use during those services. We can follow a traditional model where it looks like where we're meeting face to face and we talk to each other, and that's awesome. But it also, telehealth really enables us to convey a lot more information, to help folks to identify resources, to kind of increase engagement. So really, sometimes taking the time to plan for that can be really helpful. So telehealth also affects how providers build therapeutic relationships. And so it's really important to acknowledge the difference between in-person and virtual visits, because we really, that audio and video delays can hinder rapport, and that so we're going to use traditional methods and to emphasize nonverbal cues to help bridge that gap a little bit too. When we meet with folks, really try to have that initial casual conversation, a relaxed atmosphere, so it kind of resembles an in-person setting. And we want to arrange in-person meetings when needed, especially for initial or periodic sessions. And then even though that's not essential to successful telehealth, in-person visits can really be beneficial for both the client and if the client and the provider prefer them, and talking about those decisions collaboratively. Okay. And then the last piece that I think is going to be really important to think about is how do we familiarize clients to using telehealth, right? The technology practices. We want to ensure that they have the necessary technology. So we want to, during orientation, we want to ask about their experience with video conferencing, their internet access, and their device preferences. Because also, if you're going to do different types of activities in your telehealth sessions, it's really going to be helpful to know, like, are they on a computer? Are they on a cell phone? Is it a shared cell phone? So we can offer written or video guides on using the platform, including the necessary apps, and as well as how to access session links too. How are they going to get that information? Discuss troubleshooting for audio-visual issues and encourage clients to speak up if they have difficulty hearing or engaging. All right. So again, too, it's really important for clients to know what to expect, that you want to inform them ahead of time. Let them know that the provider is going to be taking notes, and that doesn't mean they may be taking notes, but their focus is going to be on what's being discussed. And then clarify expectations around the camera. So for instance, for our groups that, well, one thing about the camera too is like the angle, the quality, the screen size, they really can limit your ability to read a participant's nonverbal behavior. So you might need to ask to make adjustments or aid in reading to help you to read those nonverbal cues. So in our adolescent groups, we expect the cameras to be on unless the participant has to step away. So they can blur their background for privacy, but cannot use an opaque background. And it's just really so we can confirm they're in a private space, not in a car with their parents, not on the bus, and not with other people hanging out in the room. And I think, so thinking about what are those expectations, and also knowing that you're going to sometimes have therapeutic reasons to have exceptions for those expectations too, that there's reasons for that also. And so it can also be really beneficial to really like have that, the assessment of their experience with the platform, that you would maybe have an initial session with them to connect and practice, have a little test run before, can be really valuable. And one thing you're going to want to do is to really set the behavioral expectations. So it's important to communicate prior to the session in order to reinforce really the norms that we're trying to create in groups or even in individual sessions.
I got an interesting question for you. Are there any rules about people using their phones in the bathroom?
Say one more time, sorry.
Are there any rules about people using their phones in the bathroom?
Oh, for us, and particularly as long as they're in a space that is private, right? Some folks have not a lot of private spaces in their homes. So as long as they're in a space that's private, we don't have any rules around that, as long as they're engaged in a way that's appropriate for group. Yeah. Mm-hmm. And so about things too, like asking folks to dress comfortably, like what they would normal attire. Otherwise, folks might come not wearing shirts or whatever it might be. So for us, we tell our kids to think about like as though you're coming to school, wear is what you would wear to come to school. But to be comfortable, and also to remind folks not to multitask during the session. So maybe at the beginning, have a reminder, everybody turn off all your other windows. Put your phone to the side, watching video, are they watching videos or browsing the internet, asking them to really be focused. And then any other guidelines that you want to establish and review with participants. So for instance, for us, we have an expectation that during telehealth group that folks are going to sit up. And it's really because, our clientele is usually teens who are joining from their bedroom, right? So they want to lay down. And so, in establishing the expectation of sitting up, we really considered engagement, but also safety for all the youth, all the group members too. So providing those kind of guidelines can help to establish norms for telehealth sessions and reinforcing them, but also again, keeping in mind there's going to be therapeutic exceptions sometimes.
So we have a question
yeah.
and a comment on the bathroom question. Michelle had a friend whose patient was using the bathroom during their session. He's male and she was female. So I'm assuming maybe she felt uncomfortable hearing him urinate, or, I guess that could be a.
Right. So if that was, yeah, those are all those kinds of things that sometimes I think that we learn from experience too. And so, right, that if people are going to be in a bathroom, it's got to be a private bathroom, right? Those kinds of things that you kind of think that sometimes you think you don't need to bring up until something occurs. And so it might be that this is the only room. So, okay, so maybe that's not going to work because people are going to need to go in there. So maybe you're going to sit outside in the car or find a space outside, right? So really that only works if no one else comes in during that time. No one is using the bathroom, right?
Yeah.
So,
Oh, he's the therapist. Okay. So,
mm,
oh, the patient is female and she went, wait a minute. Anyway, yeah, it goes both ways. So I guess the patient was uncomfortable with anyway.
yeah, yeah.
And then we've got a couple questions about recording the consult. So how does recording the consult affect the responsibility, and what rules are there about recording consultations? That's interesting.
So with consultations, you mean they just mean like sessions in general, like the recording? Because yeah, that's.
I was assuming it was like a provider to provider. Oh, but what did you mean, Dr. Cohn? But yeah,
I
but
meant
actually,
the telehealth meetings with patients or clients. And you could include with consultants as well, but I'm specifically concerned about what are the increased responsibilities and or rules about recording the meetings.
So I think those are things that we've kind of dealt with for a while in the sense of like, say, for instance, when there are students that are going to be recording sessions, then like that's been something that's occurred for a long time that they need to record sessions for their learning opportunities, right? So how is that information going to be shared? Who's it going to be shared with? Are there consents for whoever it might be shared with? If it's something where we're recording, like, and what is the purpose of us recording it too? So for instance, like when Zoom started having the AI summary capacity, somehow we found like people were quick to just turn on during our groups. They were quick to like turn that on. We're like, no, don't, there's no need for that. We don't need that. You're going to write a note separately. You don't necessarily need that. So why would you record something unnecessarily? But Zoom has this new feature where relatively new, where you can pay to have it write encounter notes have you write progress notes for you. So for instance, that would be one where, okay, it's going to be recording, and it does it for in-person too. You turn it on and it can do it for in-person. And so that is an organizational decision that then you would need to write up all of the policies and procedures around that. And of course, with HIPAA, it's always like, who needs to know this? And if it's being, so the information, is it just being listened and written up? Is it being the person like you're saying, is the person being seen? And is that being recorded, and how is that being saved? So I think the key with all of those, as far as like the laws would go, I'm not sure what the laws would be except for the case of redisclosure, right? So anytime that you're redisclosing information for substance use disorder clients, which is different than with medical or general mental health, you need to have a consent to redisclose that. So whether you're redisclosing a recording, a something that they shared, you would need a specific consent for what specific information is going to be released for what purpose and to whom. Now, as far as like a medical, yeah, that's a good question. And I'm not sure if anyone else has any feedback in terms of um, other areas and recording. Does anyone else have any thoughts on that?
We did have a comment that it was an interesting question.
I'm sorry, how is malpractice affected? How will malpractice be affected by having recordings or not having recordings of telehealth conferences? Big can of worms.
Yeah. Well, and some folks consistently use recordings in their practices already, right? So what happens, like, so for instance, my nephew is engaged in a program. He has autism. So he's engaged in a program where they're helping him to, he's nonverbal. So they actually record every single session. They actually put it on YouTube that's only accessible to the family. So there's a whole series of consents that have to be signed in order for that information to be recorded and then to be made accessible to the family through a YouTube link, right? That not everybody can see. But it also kind of protects the provider too. So in that situation, they just make sure that they have the consents to provide that, and it can protect the provider too, but maybe it doesn't always protect the provider too. That's interesting. Any other thoughts on that?
So we're out of time, but actually, yeah, this is interesting. This is got more people thinking. Is it like the dragon recording physicians used? Does it become part of the medical record? Many insurances now require providers to do face-to-face. So yeah, you would have to save your recordings in a HIPAA compliant, safe space. Yeah, lots of thought on the recording bit. So maybe we could have you back to talk about the recordings and to go on from here.
Maybe, but yeah, I have to think about that because I have a couple of things on engagement too. I can always send some stuff to you folks out too with some of the engagement pieces too that we utilize too. So yeah, right on. But yeah, it's very interesting, all the logistics, and also thinking about, I really think the payer part is kind of interesting too, right? And how it's changing, because actually initially I had some slides on sort of Medicaid, Medicare, and but some of that stuff has changed, right? Changed after the pandemic, after the public emergency ended, and it's probably going to continue to change too. And then for agencies, like for instance, agency like us that has lots of, has county grants, federal grants, state grants, we have multiple insurance, that you have to pay attention to what those particular rules are, particularly for reimbursement. Yeah. Mhm.
Okay, so hopefully, oh, there's a comment on your wall paint, very interesting. Hopefully we can get you back to maybe have a discussion about this and maybe give some case examples. We'll get everybody thinking. Next week, we have a very pertinent topic. We have Introduction to Gender Affirming Care in Psychiatry. Don't tell the current administration that we're talking about it. No, I'm kidding. You can tell anyone you want we're talking about it. Yeah, let's talk about maybe, will everybody email me if they have questions, cases where they've done telehealth and it's been funky, or you have questions, and then there's the question about recordings. And let's talk later about that. How about that? Because this was very helpful. And I love the way you said what sparked me the most was you're like, we have more capacity to do things on telehealth than we necessarily have in person. And I'm like, I didn't think of it that way. I mean, yes, the save time, the save travel, everything, but yeah, we can show things online. We can share documents and stuff. We could even play games. So anyway, thank you so much. This was very informative.